where we're headed.
We're living in a very divisive society right now.
For the voters who were denied their right to be heard, that should anger you.
What are we doing here in this administration?
We had a hard time getting candidates even to just say Black Lives Matter.
I will stay in jail for the rest of my days rather than make a butchery of my conscience.
We're going to use every moral, non-violent tool at our disposal.
It was time to make the case that human rights and women's rights were the same.
This is such a powerful moment.
This is how we're all living.
We're living through a mass rejection of reason.
We lost about 80% of our business in 8 weeks.
By the time this is done, we'll be at over $20 trillion of total economic cost.
I just got a message. The Republicans may let the CR go on a voice vote. If so, do you want to call for a recorded vote? But leave it up to Steny.
If you have to run the House of Representatives from this interview, that's fine.
Society wants us all to live in a box and eat hamburgers and watch dumb TV.
Everybody has a compelling story if you're just willing to listen.
It's we the people that make the difference.
The goal here is to create participation.
And we can use our voices to make sure that we hold people accountable.
There are periods in American history when we've made large, profound leaps forward.
Welcome back for a conversation produced by our underwriter, Humana. To discuss unlocking the potential of technology to advance health equity, please welcome Wandu Olewola, Chief Health Equity Officer and Senior Vice President of Humana, Autumn Glover, Senior Director of Community and Civic Engagement and President of Partners Achieving Community Transformation, Garth Graham, Director and Global Head of Healthcare and Public Health at Google and YouTube, and William Schrank, Chief Medical and Corporate Affairs Officer of Humana.
Hi, my name is Will Schrank. I'm the Chief Medical Officer at Humana, and I am really grateful to have the opportunity to participate in this really important and fascinating conversation about the opportunity, the possibility of leveraging technology and unlocking the potential of technology to promote health equity. This last year has been an extraordinary one. I know it sounds cliche to say, but it has been an extraordinary year for a number of reasons. I think we've all seen that very bright light that was shown on the fact that there are profound inequities, profound disparities in how health is experienced and health care is delivered in this country. We've also seen at the same time this remarkable explosion in the use of technology, the ability to reach patients in their homes to deliver health care. And while, again, it may sound cliche to talk about the silver lining of COVID, the discussion about how this rapid expansion in the use of technology to deliver health care and its ability to change the way care is delivered, the way care is experienced, the way health is achieved, is a salient one in the industry, and in particular, the ability to leverage technology to promote more equitable care and more equitable health outcomes is a topic we have to spend time to discuss and explore and really probe. We're going to try to address 3 key questions in this discussion. The first is really around the extent to which technology can promote a more integrated, holistic approach to delivering healthcare. The second is around data and how technology can help us to better understand disparities and understand the social context in which Americans live. And the last is a deeper focus on how and the extent to which telehealth and this leveraging of technology is sustainable and feasible and can really end up supporting the way in which we reach patients where they are. And I'm very, very excited to share with you who's joining us for this conversation. 3 truly extraordinary folks. The first, Dr. Wando Olaiwola, the inaugural Chief Health Equity Officer at Humana, someone who I feel very fortunate to be inspired by every day as we try to really find that mission and define that mission around how we promote equity for all of our members and all of our patients. Our second is Autumn Glover, who is here. She's the president of the Partnership of Partners Achieving Community Transformation, otherwise known as PACT, an organization in Ohio, and she also works at Ohio State University, an organization that is really deeply focused on promoting engagement in communities and fostering a more collaborative community approach to promote equity. And last is Garth Graham, a man who needs no introduction and whose career I've followed now for longer than I'd like to admit, a true leader in the area of promoting health equity, and someone who now has a pretty extraordinary perch as the global health leader at YouTube and at Google, focused on how to leverage that technology to reach more and more Americans. Thank you all for joining. We're really, really grateful to have you here. So let's start with you, Wando. There's been this sort of extraordinary growth in the use of technology. We found at Humana, as you know, that as we've provided our typical proactive outreach over the course of the last year, we are learning different things from our members. Our members are not responding in the way they had typically. There was a much more openness around sharing the really sort of personal and often profound challenges day to day that they're facing, accessing sort of basic needs, and whether it's around social isolation, around food insecurity, housing insecurity, difficulties with transportation. Our members are really struggling with the uncertainties that were posed by the pandemic. Can you talk a little bit about how technology in those circumstances help for us to think more globally about providing holistic and integrated care?
Yeah, well, thank you. It's great to be here, and great to be with this wonderful panel of people who I respect and admire so much. And I really like what one of the previous speakers shared, which was that, COVID did not cause a lot of the problems and the inequities that we see in our society. It just highlighted them. And I think it's really important to center ourselves around that notion, because a lot of the challenges and the structural and social inequities that we saw emerging and with the light on them during the COVID pandemic were really the result of decades and decades of structural and social racism and discrimination and poverty that really rendered so many communities vulnerable when a pandemic hit us of this nature. So when you think about when you have people that are already, at risk of being disenfranchised from health and healthcare, and that have been made vulnerable by a lot of social and economic and structural conditions that are no fault of their own, and you now have a pandemic where you need to be connected, it does require a different way of thinking about what connectivity looks like. And in this example, one of the things that was important early on is making sure that we even just knew what was the impact of the pandemic on the populations that we were taking care of. How were people responding? Who was being affected? And being able to segment that and stratify it by race, ethnicity, and so many other social and demographic variables that are important for us to really know how to respond. So at Humana, we made a really concerted effort to expand the opportunity to get closer to where people are and center our care delivery model and our relationship building with our patients and our members around them being in their homes, them being in their schools and their places of work that were not in the healthcare office and environment. And that meant, one, really having very solid data to understand the impact of what was happening on our members and being able to look at that in different ways. But also thinking of what does healthcare delivery mean in our new world, and being very thoughtful about how we approach the expansion of telehealth, being upfront, and early up in the line, saying that we would recognize the in-person visit as the same as telehealth for our members, and being able to do that without shifting that cost over to our patients and our members. We expanded a lot of our telehealth policies, and obviously there was a lot of national momentum around doing that as well. Another thing that was really important is really understanding how do we re-engineer the way we work to be able to accommodate, understand, and integrate the social needs of our patients into the work that we do every day. And so being really, really excited about the way we kind of started to hear and put our ears to the street and listen to hundreds of thousands of our patients, our Medicare Advantage members, to understand what their comprehensive social needs were. And we had millions of screenings that were done to be able to understand what people were feeling with financial strain, food insecurity, housing challenges. And those insights allowed us to really expand the rest of our portfolio and be more thoughtful in the way we started to engage people, and particularly in the care that we are now providing in the home. And so I would say the home is the third way. So, the third thing. So understanding our data capabilities, using telehealth, but informing that with the data that we have, and then now expanding the care to be delivered in the home, and recognizing that comprehensive primary care actually can be delivered in the setting of someone's environment where they're comfortable. And as we have now taken the reins over Kindred at Home, which is a large home health organization, the largest in the nation actually, this will allow us to really expand that in-home care strategy and meet people where they are. So I think that there are a lot of ways that you can go about pursuing equity by really centering the patient, informing your work by aggregating and disaggregating data, understanding the needs of your subpopulations, but also, and very importantly, making sure that you're asking people what their needs are, understanding how to best engage with the community, and then leveraging the technology that you have to be able to allow them to experience really good care.
Thank you. That's really helpful. Autumn, I'd love to ask you the same question, and maybe you could just begin by telling folks a little bit about tech, and share with us your thoughts about where sort of technology has fit in over the course of the last 14 months to try to address the very personal needs of members in the community.
Absolutely. Thank you. So first I'll say, as you shared in the intro, I have 2 full-time jobs. So one of them, I serve as a senior director for community and civic engagement at Ohio State's Wexner Medical Center, where I'm thinking about community engagement partnerships, some of which Dr. Olayiwola kind of mentioned how we think about those. But also I have the great privilege of serving as president of PACT, which is a 10-year-old nonprofit. It's a community-based organization focused on disrupting cycles of intergenerational poverty. And we do that work by investing in projects and programs that are addressing social determinants of health. We do that work, most importantly, focused with a undergird of community engagement. So we don't do anything without talking to our community members. The neighborhood where PACT is focused is about 800 acres. So it's a pretty large urban community, and neighborhoods like it exist all across the country where many of our listeners live. It's a community that was really deeply impacted decades ago by highway construction and other poor public policy like redlining. And so I have, again, the privilege of waking up and thinking about this every day for about the last 10 years. And so as COVID hit, both as a health system, but then also as PACT, certainly telehealth, quickly became an important part of our healthcare ecosystem. It's an important part of the continuum of care. But what we saw is that while thousands of new telehealth visits were happening, the same patients who were missing appointments were also missing telehealth appointments because they did not have access to the internet. So while telehealth is incredibly important, there are still equity issues presented in that as a delivery option for our patients, our community, our members. And so some of the work that we led at PACT in the pandemic was really getting at the heart of the digital divide. So many of you probably had community-based organizations in your neighborhood thinking about food insecurity. And so standing up food pantries and emergency food assistance. But me and my team were thinking about how did we miss this problem? So 10 years of work, we had never truly thought about the digital divide. So we ended up paying people in the neighborhood to go door to door. We trained them. We provided them with PPE to ask people, why don't you have the internet? What can make it more accessible? And what would you use it for? So I know today we're thinking about access to healthcare via telehealth, but recognizing that the internet generally is a platform for life. And so when you're under a stay-at-home order, suddenly you need the internet to do all of the things that you may do in person. So going to work, going to school, signing up for benefits and services, that sort of thing. And so our work has really focused around creating household access to the internet, recognizing that it would support health and well-being, of course, with access to telehealth and information, but that is just as important as access to work and education, and even I'd like to say social benefit. So I certainly hope that telehealth continues to be a part of our continuum of care, because I think it provides a lot of different points of access differently for older adults, let's say, maybe people coming from rural communities saving on transportation costs, but especially populations made vulnerable, saving money on transformation, but importantly, saving time. And I think time is another social determinant that we should think about when we're creating these new opportunities, that time is not equitably distributed when you're living at the margins. So.
Yeah, thank you. That's fascinating. And that topic of sort of access to technology itself, to the platform, to the internet, as a source of disparities has gathered a lot of attention and focus over the last year and a half, as that is a real potential source of disparities in care delivery. At the same time, that platform could be an incredible source of information and a great way to capture information from patients. And for many, that platform itself is seen as a real unique lever to reduce disparities, to gather data, to share information. Probably nowhere is that better evidenced than at YouTube and at Google. And Garth, you find yourself in this really unique position with the ability to sort of think about how to leverage that platform to promote better health and better health outcomes, better information. How are you thinking about sort of the platform as a mechanism to promote equity, collect data, share information?
Yeah, well, thanks, and thanks for all that you've been doing over the years, not just at Humana, but in your career tackling health equity at a variety of places, both in the federal government and the private sector. So, if you think about platforms like YouTube, 2 billion people engage in a platform. I often say the world only has 7 billion people. So it's about a third of the world's population from all different walks of life. We have the ability to deliver information, particularly health information, to communities across the world, from Geneva to Brooklyn, to Sao Paulo, to South Miami, in all kinds of unique ways, and motivate people to make healthier decisions about their lives. And people are coming to platforms like ours primarily looking for things like health information. I often say gone are the days when you would tell people about positive things they can do about their health through a flyer or a billboard. People want it in the palm of their hand. They want to be able to access credible, evidence-based information that's engaging and explained to them. I mean, well, whoever thought we'd have to explain to 7 billion people what messenger RNA is? But that was an integral part of convincing people to take vaccines. And so, understanding the complexities and the abilities and the capabilities we have is, I think, a part of our mission. And we're able to do a lot through the pandemic. Similarly to, I think, the vision you all had at Humana about, meeting people where they are at home, meeting folks where they are online with culturally relevant, culturally specific, tailored information through channels that they were familiar with getting information, but then having Dr. Fauci present or another source of science and information present to motivate people, I think was part of our vision. And I think we executed well on that during the pandemic. But I do want to say that, part of technology is really, it's not about the platform per se or the tech aspect. It's about meeting people where they are, whether that's at home, as you guys have articulated well at Humana. But for us, it's also engaging them where they are online and meeting them culturally with the kinds of information that will educate, inform, but also inspire them to make the right decisions.
And just to build on that, Garth, how do you define how did you sort of build the agenda around how to be most sort of thoughtful and evidence-based and directed around educating folks throughout the course of the pandemic?
Yeah, kind of a two-pronged approach. One, there was the science. So I think as the evidence was evolving, people wanted the evidence in a real-world way. The other was understanding, wanted it to be engaging. No one's going to break out a textbook and look through the words for definitions. They're going to want the information to come to them in ways in which they understand, ways in which they, gather other pieces of information about their life. So I think, there's evidence-based, but it has to be engaging, it has to be culturally relevant. And that's how we target issues like disparities, is by making sure that we're have information, particularly for disparity communities across the world, in ways in which folks will understand and be engaged with the information. And again, deliver science in a way like it's never been delivered before. And I think that was what we were able to accomplish during the COVID-19 pandemic.
Yeah, that's really helpful. Wando, maybe you could comment a bit. How do we at Humana leverage technology to capture more information, to learn more about sort of the personal challenges, the basic needs, the experiences of our members, to be able to help address some of these issues and be part of the solution?
Yeah, well, thank you. I think Autumn said it earlier, you can't do anything for communities that you're serving without talking to them and understanding and really getting good visibility into the opportunities, the challenges that are faced, but also where you can potentially make a difference with their understanding and their trust. And so I think before, you think about starting to ask people about what they need and how we can be helpful, it's important to build that trust. So really proud of the work that our Bold Goal teams have done. Our Bold Goal was a goal that Humana set a few years ago to increase the number of healthy days that people experience using the CDC Healthy Days tool by 20% by the year 2020, and has resulted in massive national effort across the nation in many of our key markets, where we have population health leaders, community based partners on the ground, working every day to understand the needs of every community that we're serving through this program. And through that, it's enabled us to have very key conversations with stakeholders in our communities, members of our plan, and associates within our company. And that has led to millions. I think we've done over 6 million screenings that have given us just a tremendous amount of insight into what people are facing and what those needs are. And so now it's taking that information and we've been translating that into some pilots where we're looking at, value-based insurance design. What could we do differently? What could we provide that would help be responsive to some of the things that we found through that assessment and those conversations? So I think it's really important. And then even hearing more about, as to the points my colleagues are making about what kind of digital related capacity do people have? What kind of technology access do people have so that we can be thoughtful as we're bringing solutions and services? So one thing that we uncovered through this was the challenge of digital literacy, but also social isolation. I think Autumn mentioned that earlier. But understanding that so many seniors across the country, millions of them, lack broadband access. So even if you say we're going to provide the opportunity and cover a benefit such as telehealth for you, it doesn't mean that people would be able to necessarily access that or access, internet services for other needs and other social and emotional and needs that they have in their day-to-day lives. And so one of the things that I'm really proud of that our Bold Gold teams and our Humana Foundation worked on was a program that helps to actually provide digital literacy skills and equipping seniors across the country with tools to be able to understand how to use the technology that's in front of them, where to access it, and also working with community partners to support the access to broadband in the communities. And at the same time, providing what we uncovered in that screening process, which was a lot of social isolation and loneliness, partnering with a national program called Pop-Up Pals to make sure that our seniors have access to companions and people that can, help them with some of their day-to-day life decisions and activities, but also provide some of that technical fluency that's necessary for this reality that we're living in now.
Yeah, thanks, Wando. So Autumn, I'd love to shift this to you. You highlighted sort of that digital divide, if you will, as a potential source of disparities. However, the ability to sort of reach people in their homes, understand the context in which they live, make care and interactions more convenient is certainly a recipe for reducing disparities. And this sort of there's sort of a contrast here, a conflict here, a tension, if you will. How do you think about sort of the staying power of telehealth, the trajectory of telehealth, sustainability, so that we continue to leverage these technologies to be able to really focus on these issues that we care about so much in community?
Thank you for that. I think, one thing I'll add to what Dr. Olayiwola shared is that our work in Columbus is really focused in one neighborhood, but it is really a model for our entire county. So Columbus, Ohio is a part of Franklin County, and multiple organizations, including our public library, our foundation, our school district, a number of partners came together to really think about how we could do a coordinated strategy around closing the digital divide and creating digital equity. It's actually called the Franklin County Digital Equity Coalition. And, as we were doing some of that exploration, what we found, and I know that this is likely true in other communities, but to Dr. Olayiwola's point, older residents are especially likely to be unconnected. And so when we were looking at the data for our county, older adults over 65 are nearly 30% of the people who are disconnected. And so when we're talking about affordable and effective internet and access to devices that people own and digital life skills, we have to think about the populations we're serving very specifically. Of course, we may also naturally think new Americans are also at risk, and that's a population that deserves focus, and children with schools and people with disabilities. And so you really start to get a handle on how to approach it. Again, when I think about telehealth specifically, it has to be a part of our continuum of care. We just need to make sure everybody can get it equitably, because it does provide some convenience, right? There's less cost in transportation. And I know at OSU Wexner Medical Center, we've calculated how many miles of distance we've saved, especially for populations in our rural communities that are traveling in for care, that it's saving time and energy for those visits. And so right now, at least in Ohio, we're in a space where, we're able to continue to offer this access broadly due to a public health emergency. And so we're actively leveraging our advocacy channels to really show how this is helping and working for people. But I think importantly, if we're really solving problems around digital divide, to continue to expand our thoughts around what the internet provides in people's lives. It's 2021, and if you can imagine that there are some people who have never had internet in their home, and you think about all the times you touch the internet, perhaps even before you brush your teeth, there are some barriers there. And so as I think about this work long term, I give just strict homage to the people who have been studying it for decades. The digital divide has been studied literally. The Brookings Institute, for example, a colleague of mine, Dr. Nicole Turner-Lee, has been studying this literally for 25 years. But I think this public health crisis has pushed us to really work to solve it. And it started with making sure kids could keep learning, but now we recognize that, wait a minute, we can do a lot of things at home if we have access to the internet. I love Dr. Graham's point around health information, that people are Googling everything. And as a mom of a toddler, I Google everything, red bump on elbow, that sort of thing, and helping people learn how to navigate their lives using the internet. So I think we've proven the value in it. What we now need to do is make sure that the access is equitably distributed. And so that's where I'm working now. And we actually have a pilot going on in the PAC neighborhood, giving people access to the internet for free. We recognize that even populations made vulnerable have to be convinced that this is for them. We need to convince them that telehealth is a great solution, and that, doing their business and their banking online is an added benefit to their lives, and really treating them with dignity and giving them an opportunity to stretch and grow in those spaces as well, because it's not just if you deliver it, the people will come. You have to make the case.
Yeah, that makes good sense. And I'm sure, Garth, you have a lot of thoughts on this with respect to our role in promoting equitable access to technology and to the internet, but also our ability to provide the right kinds of messaging, the right kinds of sort of portfolio of information to really help support the needs of the folks we care for. I know that's pretty open-ended, but where would you take that?
Yeah, totally. Great question, Will. And I think it's also interesting to understand the history, as Autumn just pointed out, of even not just the research on digital divide, history on health equity, the definitions. I love the Robert Wood Johnson definition that health equity is all about removing barriers to allow people to live their best lives. And, go back to 1914, when Booker T. Washington first tried to identify the issue as, not first, but identify the issue and talking about Negro Health Week. And the point here, Will, to answer your question, is that throughout time, people have talked about health equity reduction as a way for people to live their healthiest lives. And now we're thinking a lot about how we use the technology component of that, health information, what the things that we do, the tools we give people to empower people to live their healthiest lives, and the way the system is built around the infrastructure. That's our real opportunity here. And the thing is also understanding the lives of the people we're trying to impact. We have to start with understanding both the social conditions, the economic conditions, but also the framework in which people are relating to health information and other sources of how the healthcare infrastructure is built around them. So we start by thinking about the community first, and then think about how we can meet those needs. And I think that's part and parcel of much of what Autumn was just saying in general about being very focused on meeting the needs of the community, ideally.
Yeah, that's helpful. One thing we've found is we're just sort of thinking about what within the ecosystem promotes utilization and that staying power of telehealth and the use of technology. We did a study that we just presented a couple weeks ago at Academy Health, looking at the relationship between whether or not providers are in value-based arrangements versus fee-for-service, and the likelihood that they adopted and how it sustained the adoption of telehealth was. And you'd think at a time where there was reductions in access to care, there are fewer patients seeing their doctor, that it's the fee-for-service doctors that had all the financial incentives we were paying for those visits, for them to deliver those telehealth visits to be able to bill for them. But in sort of counter to what the financial incentives would suggest, there was a much more rapid uptake in providers that are paid for value rather than paid for volume. And that was considerably more sustained over the course of the pandemic. And it really highlighted the notion that value-based providers had the infrastructure and the orientation to really care for patients. Despite the fact that they might not have had the financial incentives to do so, or as intense a financial incentive, just that sort of baseline, that early investment, that transformation towards leveraging technology to support care delivery, put them in a far better position to be able to care for the chronic needs of their patients. And as you know, those value-based providers, Medicare Advantage in particular, disproportionately care for patients of color, vulnerable patients. I think it really brings to light this sort of notion of sustainability in the context of efforts to promote equity, and how sort of these more progressive payment models, more progressive ways of engaging patients can really foster the right investments to be able to address patients' needs better, but also address some of those equity issues. Wando, that brings me to you. I'd love to hear your thoughts as we think about sort of sustainability, as we think about how, where sort of how we're going to leverage technology to meet patients where they are in a sustainable way, how we're going to, sort of dig deeper around leveraging technology to meet the very personal and oftentimes the socially contextual needs of our members. Where do you see, coming out of the pandemic on the other side, where do you see that trajectory going? How do you see that playing out?
Yeah, that's a great question. I think a few things. One is certainly just making sure that we don't lose momentum and interest in understanding the needs of the populations that we take care of. And I think to Autumn's point, that community engagement and community conversations are not a one and done. You don't ask and then you do something and then you disappear forever. So making sure that we have this kind of ongoing mechanism to be able to gather insights from the people that we serve, and being very, very thoughtful and intentional about that. I also think that, to really have long-lasting structural change will require that we bake some of the focus on health and equity into policy and legislation, and we kind of legislate equity, if you will, and think about how do we also incentivize it from the perspective of people that are delivering care or wrapping, services that wrap around the delivery of that care. Thinking about how do we include and integrate folks like community health workers who have such deep understanding of the communities that they come from and that they serve, who are able to connect with patients and communities in ways that we often cannot as physicians or nurses or other clinicians. And so thinking about how do we kind of use the policy environment to really build in structures that allow us to achieve health equity. And then also, how do we align incentives so that, as you were just talking about, Will, that we're not just focused on the volume and the churn of delivering care, but we really do think about what are the opportunities with value-based care to really focus on things like health equity and incentivize work around that.
Yeah, Thank you. Thank you. That all makes good sense. And Autumn, maybe if you could build on that, as you see, things are opening up, and we are seeing sort of there's definitely a lot of light at the end of the tunnel here. It's certainly happening at different rates in different communities, but nonetheless, it feels like it's coming. How do you see the trajectory in the communities you're serving around the use of technology and where technology is going to fit in a sort of those longer term efforts around promoting equity and intergenerational collaboration?
Yeah, so I think a couple notes. One, while I do believe strongly that we have to reach people where they are and engage them, the pandemic left people feeling vulnerable, right? They have been made vulnerable in a lot of ways, but feeling vulnerable to not having access, I think has inspired people to want to stretch and learn new things. At Ohio State, we actually launched an interprofessional scholars program, and our goal was to get more older adults engaged in telehealth and using some of our learners, our health sciences trainees, to help empower our residents. And these were folks that I handpicked from our neighborhood who I knew were very unlikely to want to try telehealth. And so doing more of that, right? So it's also the training of our healthcare professionals, our future health professionals, but then also giving our community opportunities to learn new skills and how to engage with the internet, both with telehealth, but I think more broadly. And so I think people don't ever want to feel that way again. One of the other things too that Dr. Olayiwola mentioned is the use of community health workers. We have a pretty robust community health worker training program here at Ohio State, and specifically born out of PACT. And that work has always been responsive, and the way we're training those CHWs has been responsive to our most pressing health needs. So we have a group of CHWs focused on infant mortality, for example. We're also starting to think about what if we start training them as digital navigators, and we have people in the community, helping to teach our community members and empower them and answer their questions. We had the great fortune of giving away 500 brand new computers earlier this year, but recognizing that people were going to need support. And so thinking about how we add these supports into the communities where people live is really important. And certainly my work is place-based, and I can go on and on about why place-based matters, but I think getting people exactly where they are and being able to focus in specific neighborhoods is really important. And I think about partners like local libraries. They're one of the few partners that are in every neighborhood typically. And so how do we leverage those sorts of partners? We happen to have, I think, one of the best library systems in the world here in Columbus. And so they're a great and willing partner. We actually have a primary care mobile clinic that goes through our libraries, really meeting people where they are. And so I think there's potential there. As I always say, we've got to keep our foot on the gas though. So as much as we want our communities to engage and our patients to engage in these resources, we have to stay diligent in trying to get to them and creating resources and trying on new things. But again, always asking them, is this working? What would make this better for you? And sometimes community engagement can be really time consuming, but I think it's always the best thing to refine strategies and frankly, leverage resources in the best way.
Thank you, Autumn. We only have a couple minutes left. So I'd love to just sort of go around the horn here. We'll start with you, Autumn. Just if you could just give the audience just a really quick snapshot of, what's the one thing that you've learned over the course of the pandemic about the sort of the unique opportunity to leverage technology to promote a more equitable society?
I think the one thing I've learned is that we can do it. I think, prior to the pandemic, it was like this off in the distance, far in the distance goal that we really couldn't see how we would get there. But I feel like all of the ingredients are there. We have great and deep knowledge of how the internet works, right? And we know now. I wouldn't have been able to talk about this at this depth more than a year ago. So I'm very grateful for the time to focus. But I have more than hope now, I have a conviction that we have to solve these problems. And I really think about our work, the PAC neighborhood, as being a case study. We're scaling the work that I'm doing into other neighborhoods across the county because we can. We literally can solve this problem. And with that comes a responsibility that we must.
That's awesome. Garth, how about you? What's your one takeaway for the audience?
Technology, has had a profound impact on people's lives over the past, 13 to 16 months. And what it shows is how much things can change, but how much technology is embedded in people's lives and their decision making. I think we on the Google and the YouTube, and we know that we have probably the largest educational platform where people come to for information. And so we know we can empower people to make healthy life decisions and also educate them about things related to not just the pandemic, but other components of health that will to live healthier lives. But I think the thing I learned was both the power of technology, but more importantly, the power of people to utilize technology to make those decisions that hopefully get us in a better place. And decisions is all about, that's kind of how we made our way out of this pandemic, our decisions to take vaccines, our decisions to social distance and make some of those healthier choices. So a lot of this has to do with how we use technology to empower people to live healthier lives.
That's awesome. And Wanda, we'll let you close it out.
Yeah, those are both great. I will say that what this pandemic has shown me and taught me is that people all over the world and all over this country are very, very smart and very resilient. And despite the fact that so many communities and so many people have been underserved and disenfranchised, there is a tremendous will to achieve good health and to build our communities back. And so I feel really inspired by the fact that people who, as we were saying earlier, maybe have never touched certain types of technology or never interacted with certain software or hardware found their way to do it during the course of this pandemic. And it shows us that we can accelerate uptake and adoption and equity all together. And then and that technology really is power. And when you realize that the last few months have really been predicated on our success in being able to leverage technology and logistics and supply chain and all sorts of other things. But I think that power has shown up, and the resilience and strength of communities across the country is really apparent, and it makes me so happy.
Well, thank you. Thank you, Wanda. Thank you, Garth. Thank you, Autumn. We really, really appreciate your time and your wisdom and all you're doing. And we will hand it back to the Atlantic.
Thanks again to all of our speakers. We're going to take a short break, and we'll use this time to learn a little bit more about our viewing audience today. We invite you to participate in our interactive polling. On the right-hand panel, click on polls to respond, and we'll see you back here shortly.